And it's Sunday.
It's 9 o'clock and we are live.
Again. But amazingly, we have our lovely Dr. Q with us.
He's looking very dark.
I know, look, he's dressed up for everyone.
Pink shirt.
He's dressed up. Yeah, so Mum's decided to rock this god-awful headband again.
I know,
but
I'm sorry.
It's fine because it's been noticed by a number of different people that it's horrific.
It's my villain look. It's my villain look.
Right, how do you say Malcolm?
Malcolm.
No, you say it Malcolm.
No, you say Malcolm.
You don't say Malcolm. Nobody says Malcolm. It's ridiculous.
Oh, she just does my head on. She really does.
That's because she can't speak.
So, I have some hellos to say. I have to say hello to the girls in Ward 6C, the ones that look after my mum. They've been so good. They look after her with such nice care. And I have to say hello to everyone at Glen Morrison Hotel where we had lunch today. And especially my Latvian waitress, who was fantastic and said she watches us every week. So hello, and I hope you're well. Thank you for lunch today. So that's my thank yous for the week. People are now stopping us in the street and asking us to say hello.
I know, it's bad. It's like the lady from Tesco's. Mind I told you that before? Oh my goodness, this lady stopped me in Tesco's and I was wearing my jammies, guys. It was bad.
Really bad, you have no idea.
So obviously with Dr. Q today means that we are going to be doing something that's not quite Mum's forte normally, but it will be needles. So yay! So what are we doing today, Dr. Q?
Right, see, last time what we did was we put some fillers here to try and lift this area up a little bit. Today we're going to do the sort of second part, which is we're going to put some filler in the jaw angle here, you know, just to give it a bit more definition here, and then some filler just under the chin to basically stretch this area out and
get rid of
the
the jowls, because everybody hates the jowls. Everybody goes,
Is that not? Turkeys have jowls, don't they?
Turkeys have jowls.
We're coming up to Christmas. You could be called like the Christmas turkey.
I
Oh
know.
my word! I'll sell that to Isabel. Can my mum come to dinner? She can be the turkey.
Here's the turkey. Yes, I do have jowls. That's because I'm old. So what can you do?
Well, you're old-ish. That's about as nice a compliment as I'm going to give you. You're old-ish. You're not too old.
Oh my God! We were in the house this morning. Charlotte is now staying with me again. It's the Boomerang family. Her house has been flooded. She's back staying with me again.
Right.
She comes through to me in the morning, and all I hear when she speaks to me is wah 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 wah, wah 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 wah, £50. Wah 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 wah, £150.
I didn't say anything this morning.
And how much? No, every morning I just hear it. It's like white noise to me. All I hear is the amount she's wanting.
That's not true.
It's true.
That's so not true.
Everyone knows what it's like.
Look,
Okay,
the
so
headband
there
is
we go.
horrific. It's really standing out.
I've got 3 new ones I've ordered.
Thank the Lord for that. Please don't tell me that they're like something like Ellie's got. That actually, I wouldn't even buy that for Ellie. I have to be honest.
Did you buy this or were you?
See?
I was not confident. I actually did it.
So it was not a lucky dip, and she did not get the booby prize. She actually went out and spent her hard-earned money on that.
I think it's a good buy.
It's
Goodbye.
goodbye for a child, but
No, I think he's trying to say goodbye.
yeah.
To it.
But I'm saying it's probably not a bad buy for a child of 10 when you add 50 to that.
How much did it set you back?
£10.
You never. You spent £10 on that.
I liked it. I thought it was cute. Anyway, do we have to slide my head back? So
Yeah, stop wearing it.
Right, shall we start?
Yes. Okay. Right, down to it, guys. Let's be serious and not. Right, you're gonna have to fix your ear because you look like an elf. Oh my God, that's dreadful. Yeah, that's much better.
I take my headband off. Move my hair out the way.
Okay, you just turn your head to one side.
So I'm gonna go other side, guys. Oh, look! Someone actually likes your headband.
Oh, see?
One person.
I love you, wherever you are.
Well, I'm not sure how I say her name, but I think it's Carrie Dad, and she says hi, and she says I like your headband. So she doesn't love your headband, she just likes it
I like it too.
marginally.
Right.
Oh my
so
God,
what
they're
we're
sad.
going to put some filler in the jaw angle here. So just find the jaw angle like that. and then the filler just goes here.
Oh, I actually, do you know what? I have to say, everyone thinks that needles are really extremely painful, and they're really actually not. I mean, I know I dipped out of the one that I was going to do, but then it was scraping along my face because I think I'd just lost so much weight, and I was bloody pregnant at the time, wasn't I? Of course, like an Egypt I am, which is quite handy for Dr. Q, because Dr. Q wasn't really up for doing it anyway, because I'm a whiny, needy, moany person.
Oh my God, at least you know she's whiny and needy.
Well, this is it. This is why I get away with what I want.
You can feel it. It is, you are aware of it, I have to say. It's not like hideous or anything like that. You do feel like a tiny little pinprick, and then it feels more like kind of like a bit of pressure. But it's not too hideous.
You've got some lipstick on your cheek.
Oh God, we'll wipe it off.
I was going to spit on my finger, like, you know, like spit on the mat. Oh my God. And it was so disgusting because you do it in like a public place too. Or you'd grog into a napkin. That was it. It's like the way that everyone cleans their child's face. Like, okay, I'll my own goobers straight into the napkin and on their face. So now I'm assuming we're evening out. There we go. God, it actually is a very, very small needle. It's not a big one.
Oh, that's good. I can't see it, which is good.
Sarah says that you look in pain. She's still talking,
really
so
pain.
she's not in pain.
I'm not
She's
in
just
pain.
trying to stay still so that he doesn't slip, or she doesn't slip, basically.
I'm not. Oh, I can't see it.
Yeah, don't speak. That's probably best. But she's definitely not in pain, my darling. I can promise you that one. If she was, she's a bit of a wuss. So
No
she would be
anaesthetic. I
screaming.
didn't have any anaesthetic on. You don't need any anaesthetic with this. I'm not in pain or anything like that. I just want to stay still because I'm frightened it ends up sticking it somewhere that I don't particularly want.
Well, and also, you want to get the best result. You know,
Yeah,
if you're
exactly.
going this far, you do want to get the best result. I mean, not that this is actually very far. I mean, there was probably a vast lot of surgeons that
it's
could.
not like it's a surgical procedure. Or anything
No,
like that, yeah.
and that's it, isn't it?
But you're wanting something that's an alternative to a surgical procedure because not everybody wants to have surgery. You don't want to have an anaesthetic, you don't want to have like put under the knife and all that sort of stuff. We're looking at alternatives. And it's quite nice to see something real, live, not photoshopped.
Yeah.
Real results, not photoshopped.
Look at her face.
Oh,
Definitely
don't.
not. It's definitely not Photoshop. Don't worry, mother.
Not photoshopped.
Ooh. So yeah, this is live. We are doing it in real time. We're not speeding up any videos. I'm not touching up my mum's 15 chins or anything like that. This is genuinely us and Dr. Q. Are you getting used to us yet, Dr. Q? Are you getting used to our rubbish banter?
I just zone out.
That's it. Imagine having to work with us 6 days a week. Oh, poor Louise. She must suffer. So this is him now basically removing the turkey bit, which is probably a good thing.
You can feel a tiny little pinprick when that goes in.
I mean, you could put sort of, LMX or Angra cream, but we just don't because...
And is there a lot of swelling and bruising with this?
Not really, just what you see really.
So anything that kind of comes up at the time is going to come up, and then it doesn't really come up after that, does it?
Not really, no. So this is basically pretty much it.
And does this one, what's the word, kind of relax in or get better in time, or what you see is what you get?
It takes about sort of 2 to 4 weeks really to fully sort of materialize, if you like. Because it takes about 2 weeks to bind to the skin, if you like, and then become part of it.
And so does it genuinely become part of the skin?
Yeah, so it sort of binds to the skin and then sort of integrates with it.
And how long does it last for?
This is Juvederm Volux, so it lasts up to 18 months.
So you don't have to have this done very often then?
No. So this is probably the sort of longest lasting there is at the moment.
I have to say, Jessica's going to... I'll not tell you just now because I don't want you to laugh at this precise point, but Jessica said something that's incredibly funny. And I'm struggling not to laugh. I'm not going to make you laugh, but I'll tell you once he's removed the needle, then I will tell you and you can laugh. However, so this one will last 18 months. And do we top it up, or is it not a top up thing? Is it
Yeah, I mean,
wait for it to come all the way out?
Whenever you want, really, you know. So I mean, 18 months is when sort of it. They say between sort of up to 24 months, even in some people, but I think 18 months is a good figure.
How's it looking?
I would say it looks actually really good. It really has defined your jawline.
Oh, good. Getting rid of the jowls.
Yeah.
That's what we want to try and do, get rid of
When
the
you
jowls.
look at it that way, you can kind of see that it's straightened it out. I should have maybe gone in first when he was doing it, because there was like a small dimple there almost. Like just kind of here.
Yeah, there's a holy bit there.
And he's filled that out and it's made it look, yeah.
Better?
Yeah.
Good.
So Jessica
Well,
said,
it's really easy.
Jessica said,
This one is-
what did you use? Polyfiller. I know.
I think probably need polyfiller.
I can't make her laugh at this precise point, guys, because, well, as she stated last time, we don't really want any extras. We'll just keep it to the treatment. So I'm going to go in and just show you the bit.
So you basically just make a hole with the needle, and then this is a blunt needle. Slides in like that.
Yeah. And so you can just see. And so you inject it in and then you kind of squidge it out. But this is not to be done by just any Tom, Dick and Harry. So please don't do any of these, you know, oh, I'm having a guy round to the house and he's going to do cheap Botox for 100 quid. This is not the case. Dr. Q is a trained professional and has been doing it for a number of years now. I'm not sure how many. I know with Mum, all the stuff that she does is she's been doing for about 30 years because she's really old. But Dr. Q doesn't look as old.
That's because he's not as old.
There we go. However, Dr. Q's actually, if I believe I'm right, you're GP trained, aren't we?
Yeah, so I'm NHS-wise, I'm a GP. But I mostly do sort of A&E work now, sort of accident emergency or GP out of hours, and then the sort of cosmetic work. So that's
It's like that one, the stabbing in London. That's dreadful. Absolutely dreadful.
On the bridge, yeah.
Yes.
The terrorist thing.
See, they needed Dr. Q, but we've stolen him. I'm sorry. I'm sorry, London.
So
Right.
you can look good in A&E.
I know. It's okay, guys. Don't ask. If you're in A&E and you've broken your toe and Dr. Q sees you, don't ask him for fillers at that point. I think you've maybe got more aspects to deal with. However, you can't ask him for fillers any other time. As I just want a quick mention, because we are coming up to Christmas and we all know that there's always that one Christmas present that everybody wants and maybe can't afford the whole thing themselves. Dr. Q does offer gift vouchers and he will be offering gift vouchers through Fantasia. We certainly offer gift vouchers and we will tailor certain treatments to fit everyone. And we are open until the...
24th.
There you go, 4 o'clock on the 24th, I believe it is.
24th, it is.
Yeah, because we're coming to the Heath Mount. We're going to, I'm going to book the Heath Mount. We always go to the Heathy. We've got to go to the Heathy. It's family tradition.
Okay.
Oh, there we go. You
Yeah,
look.
how does it look?
God, you actually look a lot better.
Oh, good, good.
I don't know if it's the headband coming off or if it's the filler.
put that back on. Yeah, I think so. Yeah.
Put the headband back
There
on.
we go.
Right, maybe sit up. Okay, so I had the girls teach me how to take a photograph, right? So they said sit up and stick your chin forward. Oh yeah, see, it has made a huge difference.
What
So
do you think? Let me know your comments.
it will smooth out slightly more over time, and yeah, it's made a bloody big difference.
Better?
I think you need an ear job.
I know. My
Your
ears.
ears are weird. Why?
I know they're weird.
They're really, you've got
You're
really
making me
weird.
paranoid now. I'm like, my ears look
No, your eyebrows are really good, and this bit from here is really good. You don't have anything on the like you would
Yeah, it's
expect. It's called Dr. Q.
Dr. Q.
So we do have, I believe we have 2 spaces available tomorrow. So it's not very many, but certainly if you're interested in anything that Dr. Q might be able to help you with, in his dapper pink shirt, but he might not be wearing that tomorrow. Certainly pop in, give us a shout, give us a text on Facebook, or text Mum or me or either, to be honest. And we look forward to seeing you all over the Christmas and New Year period.
And we're going to be here next week, aren't we?
Yeah, we're here next
back
week.
Next week with like just a get up and glow treatment for somebody just before party night out. So
Hopefully you'll have a different headband by then.
I might have a new headband.
Oh my god.
Oh my god, that would be good.
Hopefully it's not so ridiculous,
I
guys.
wish I had a different person that was taking the photographs, eh?
She's such a liar. She can't do it without me.
Oh, whatever.
It's because she can't work her phone. That's the only reason.
That's true.
Right, guys.
Thank you so much for watching.
Bye-bye.
I'll see you next week. Bye.
Bye.